Good afternoon. We'll call this meeting of the Allegheny County Board of Legislators to order for April 9th, 2025. Please rise as we're led in the Pledge of Allegiance by Legislator Stephen Havey.
Please join me in the pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Please remain upstanding as we're led in invocation by Legislator Dwight Fanton.
Heavenly Father, we come to you today asking for your blessings for our county and for our country. We just pray you'll be with our first responders, our military personnel, our law enforcement, keep them safe, let them know they're appreciated. We thank you for all you do for us, and we have a special prayer for our country right now. And we just pray that you'll be involved and give us the help we need. We thank you for all you do for us. In Jesus' name, amen.
Thank you both. Roll call, please.
Mr. Barnes.
Present.
Mr. Bissett.
Here.
Ms. Burdick. Here. Mr. Curran.
Here.
Mr. Demick.
Here.
Mr. Fanton.
Here.
Mrs. Hanchett. Here. Mr. Harris.
Here.
Mr. Havey.
Here.
Mr. Healy. Mr. Ricky.
Here.
Mrs. Ricketts-Swales. Here. Mrs. Root. Here. Mr. Rumfelt. Mr. Stockin. Here. 14 present, 1 absent.
Thank you. Excited to introduce a new agenda item this month, and that is the approval of the agenda. I'm seeking a motion to approve the agenda as provided.
Fanton will move that.
Thank you, Mr. Fanton. Thank you. Seconded by Mr. Havey. All those in favor say aye. Opposed? The agenda is approved. That wasn't nearly as exciting as I thought it was going to be. But we did it. We do what we're told. Any minutes?
You were provided a copy of the board meeting minutes of March 26th, and we need a motion to approve those minutes.
Motion by Legislator Havey, second by Legislator Root. Discussion? I'm just seeking clarification. The agenda states March 23rd.
They were from the 26th, so that's a typo in the agenda.
Okay. All right, so these are the minutes for the 26th that we are approving. Any additions or corrections? If not, all those in favor say aye.
Aye.
Opposed? And those minutes are approved. This time, we're thankful as a board to have the opportunity to invite Commissioner of Social Services Don Horan, Deputy Commissioner Jennifer Bigelow, and Program Manager Kayla Johnson to join us at the front of the room, please. We've requested privilege of the floor to discuss Child Abuse Prevention and Awareness Month. I want to welcome you all.
Good afternoon, and thank you for the privilege of the floor today. April has always been the nation's Child Abuse Prevention Month. This month and every month of the year is important to communities to work together to support and strengthen families to prevent abuse and maltreatment of children. The children of our community will be our leaders of tomorrow. It is very important to know that adverse childhood experiences are traumatic to children later in life. These experiences are known to have negative effects on these children in adulthood, including poor and physical and mental health, substance abuse, incarceration, and risky behaviors. It is very important that we as a community and as parents increase the well-being of our children who have traumatic experiences. We need to help parents find resources, support, strategies to benefit all of these children. To report a child abuse and maltreatment, persons can call the New York State Central Registry at 1-800-635-1522. I would like to now have Deputy Commissioner Jennifer McMahon say a few words. I'm sorry.
He has 2 Jennifers
I have
now.
2 Jens now, I'm sorry.
I understand.
I just talked to Jennifer McMahon, so.
Thank you. Typically, I would stand before you and give you some alarming statistics and challenges we are facing with child abuse prevention. Instead, I want to share with you highlights and data points we have seen that are evolving in Allegheny County. The typical child welfare system was seen as assisting families more after problems had begun. What about starting to think about child welfare system that takes the preventative approach before abuse and maltreatment occurs? Allegheny County is striving to prioritize community-based prevention programs, early interventions, family support services, and child sexual abuse prevention programs. So what is Allegheny County DSS doing to support this transformation? We have supported the new mandated reporter training. The overarching theme to the new mandated reporter training revolves around the idea that you can support a family and not report a family. Children in foster care, our numbers have declined. Just to give you an example of some recent data I pulled, from January 2022, we had 30 children in foster care. To date, in March of 2025, we have 16 children in care. Our neglect petitions filed in family court have decreased. Congregate care placements have significantly decreased. Currently, we only have 2 youth placed in a residential program. Preventative supports, community-based services are increasing. Our contract agencies have onboarded evidence-based practices within their agencies. Allegheny County DSS and Allegheny County Family Court are partnering on a court improvement project. We are well on our way with developing a family drug court. The model program that is being developed is called Better for Families. It's an intensive judicial monitoring and equal access to family-focused interventions, services, and supports. Collaborating with our local agency Clarity for mental health, our local agency ACASA for drug and alcohol treatment, supporting harm reduction, and supporting peer and street outreach. We have 2 caseworkers that are going to be trained internally on guiding good choices, which aims to prevent teen substance use and risky behaviors by training parents to develop positive parenting and family management skills. We had our first youth summit back in December of 2024. It was very successful, and that was at Alfred State College. Our Youth Bureau is now maximizing the use of funds for youth sports and education, and youth development funds. By supporting this, it supports the health and well-being of children and youth in Allegheny County, promoting positive social, emotional, health, and educational outcomes. We have a one-family program that was a homegrown program that was created here in Allegheny County, which continues to concentrate our efforts on finding family supports and family placements. We are being trained in trauma-informed care and motivational interviewing, which assists our caseworkers with methods that involves enhancing clients' motivation, understand the client's own motivation, listen with empathy, and empower that client. I'm now going to turn it over to Kayla from the Child Advocacy Center.
Thank you, Jen. At the Southern Tier Child Advocacy Center, it is our mission to provide a sanctuary for survivors and their families to heal and make connections to resources to help them through their journey through child abuse. Last year, we assisted over 260 families, and this year, so far, we have connected with 50. While the outcomes of these cases aren't always what we hope them to be, we continue to strive every day to promote healing both mentally and physically. Additionally, we have developed a strong medical program with Dr. Coyne in Buffalo, along with Cheryl Ware and Brandis Gaylor, who are our wonderful pediatric sexual assault nurse examiners. Medicals have become an important and therapeutic process for our survivors, and the education the families receive through these services are vital. So what else does April mean, and how do we spread awareness? That's with fun. April is filled with family fun ideas and awareness events. April means going blue. The Allegheny County Courthouse lights up blue and plants a pinwheel garden on the front lawn alongside with Ardent Solutions, Cattaraugus County, the Child Advocacy Center, and Connecting Communities in Action. On our Facebook page, We have shared our annual 30 Days of Fun calendar to encourage family connections. We wear blue on Fridays. Youth coming into the center have an opportunity to participate in our annual coloring contest, and our Safe Harbor Coordinator, Melissa Tice, will be holding an online overview of commercial sexual exploitation of children on April 29th at 10 a.m. Lastly, with the support of Connecting Communities in Action, who not only help us promote mental health, well-being, and safety, we are able to continue our annual Child Safety Day, May 3rd, at the Robert Livingston Center in Allegheny from 10 a.m. to 2 p.m.
I want to thank Don and Jen and Kayla for sharing that information with us. And I'd like to, at this time, any DSS workers or any of those with our partner agencies or anyone that shares in this work of child abuse prevention and awareness, could you please rise and get a round of applause from the board, please? We know that April is the month to raise awareness for these efforts, but obviously your work is year-round and your work is very difficult and you have a lot of it, so we certainly appreciate that. A proclamation. Whereas all children of New York State and those everywhere have the right to be loved, cared for, and raised in an environment that supports their healthy growth and development, which protects them from any potential form of harm, including verbal, sexual, emotional, and physical abuse, exploitation, and neglect. And whereas within our communities, child abuse can be reduced through strong partnerships among families, social services agencies, schools, faith-based institutions, civic organizations, law enforcement, and businesses that provide supportive resources and that reinforce protective measures to children and families. And whereas we acknowledge that we must work together as a community to increase awareness about child abuse and continue to promote the social and emotional well-being of children and families in a safe, stable, and nurturing environment. And whereas all citizens share responsibility in preventing child abuse through diligent reporting of suspected child abuse or maltreatment to the statewide Central Registrar of Child Abuse and Maltreatment, the state's child abuse hotline that is available 24 hours a day, 7 days a week by calling 1-800-342-3720. And whereas the Legislature's Human Services Committee, the Commissioner of Social Services, the Department of Social Services Children's Services Unit, the Southern Tier Child Advocacy Center, and Ardent Incorporated recognize and continue to promote and administer child abuse prevention programs and are addressing the continuing issue of child abuse prevention. And whereas Allegheny County joins the New York State Office of Children and Family Services and other counties statewide to recognize April as National Child Abuse Prevention and Awareness Month, and encourages all citizens to direct their attention to this critical issue and to support programs and promote the safety and security of children, as we also take this opportunity to acknowledge the many dedicated caseworkers that devote countless hours to ensuring the welfare and well-being of our children. Now therefore, I, W. Brooke Harris, Chairman of the Allegheny County Board of Legislators, do hereby proclaim April 2025 as Child Abuse Prevention and Awareness Month in Allegheny County. Thank you. Yeah, let's get them first, and then we'll start ruining the best. We're gonna get some with, Janet. Thank you, guys. What's that? Yeah, I'm gonna make Sarah will make that. So it is noted under privilege of the floor. We've received annual reports from the county attorney, the county clerk, Cooperative Extension, Information Technology, and Public Works. In the interest of time, those representatives are available to us upon request to answer any questions on those annual reports. This time, I'd like to open the floor to public comment. If there are any members of the public that wish to address the board at this time, I'd ask that you approach the podium at the front of the room, please. State your name and town of residence, and we'd be happy to hear your comments. And before you get started, ma'am, there's 2 buttons on that microphone. If you press the one to the right, it should make a red light turn on, and then we can hear you. You've got it. Welcome.
Thank you. Good afternoon. Thank you for providing this opportunity to speak with you. My name is Marty Sabato, and I live in the Cuba Rushford School District in the town of Rushford. I'm a retired teacher and the mother of 3 grown sons, the youngest born with a spinal cord injury. My journey through both my personal life and my professional life as a teacher for 38 years has made me well aware of the importance of Medicaid and of services for the disabled in our communities, our schools, and our senior population. As I'm sure you know, Rushford is a financially poor community that relies heavily on support from both the federal government and the state. Over 21% of our residents rely on Medicaid for their insurance and support. I fear for my Rushford neighbors of all ages if Medicaid is eliminated or diminished in any way. My sincere hope is that you as a legislative body have begun to develop contingency plans to avert what most certainly will be a devastating blow to your needy constituents. I'm here to strongly urge you to address Congressman Nick Langworthy to advocate for Allegheny County residents by voting against the planned draconian cuts to Medicaid. I hope you yourselves, as our representatives, find your voice on behalf of all of us in Allegheny County. In the analysis of data for the Centers of Medicaid and Medicare Services and the Census Bureau in our congressional district, including Allegheny County, a significant portion is reliant on Medicaid. And while these numbers are for all 9 counties in the New York 23rd Congressional District, there is a remarkable consistency across each. A copy of the chart outlining this information has been made available for your review. Over 20,000 children in the New York 23rd depend on CHIP, the Children's Health Insurance Program. That's likely 272 children here in Allegheny County. They rely on health care services including vaccinations, physician services for treatment of various ailments, and for more serious diseases like childhood cancer, type 1 diabetes, cystic fibrosis, asthma, and rare diseases like Duchenne muscular dystrophy. And of course, seniors are one of the most vulnerable populations in our county. New York State data shows that 64% of nursing home occupants rely on Medicaid. Medicaid pays their housing home costs, their nursing home costs, provides for additional coverage through Medicare Part D drug plans, and serves as a supplemental insurance to Medicare. The impact on the loss of Medicaid funds to our nursing home population and seniors will be devastating on 3 fronts. First, the ability to pay for residential room, board, and services will be unsustainable. In addition, pharmaceutical costs will increase in both a monthly premium for Part D plans with the reintroduction of the notorious donut hole, which requires $2,000 out of pocket on pharmaceutical coverage, and the loss of a supplemental plan, which pays for what Medicare does not. This would be an additional expense of $350 to $400 per month. Second, Medicaid and Medicaid expansion covers 140,000 people in the New York 23rd Congressional District, which likely numbers 7,000 adults in this county. Would they just lose all coverage? Would the uninsured rate for the county go up to 22 to 25%? Wouldn't that overwhelm the county health department? How would that impact agencies and services that are dependent on Medicaid support, including mental health services? On the third front, we address coverage of those that are dual eligible for both Medicare and Medicaid. That's nearly 60,000 people in the New York 23rd District. Those people fall into 2 categories. The first category includes seniors below the poverty line who receive a Social Security or retirement payment so small that they cannot afford health care or health care expenses. And the second category includes the disabled that are recognized as disabled by the Social Security Administration and have received disability coverage for 48 consecutive months. Either they are on SSI or their SSDI payment amount qualifies as below the poverty level. Those on SSI will be particularly vulnerable as they have permanent disability, likely never worked, may live in a group home, may require Medicaid to play a role in paying for their housing, and more. We could see a 3.95% uninsured rate in our county balloon to 35 to 40% uninsured rate, impacting every part of our population. These statistics are disturbing at best. My hope is that you are aggressively working on a contingency plan, or that you are using your political capital you have with Congressman Langworthy to prevent this harm. Thank you for your time and attention to this serious concern.
Thank you, ma'am.
Thank you.
Good afternoon.
Good afternoon. I'm Maria Harold from the town of Candia. I also want to talk about Medicaid cuts. In the 4 nursing homes in our county, upwards of 64% of residents are Medicaid patients. How will these homes continue to exist when the patients can no longer pay as Medicaid is eliminated? We're fortunate to have Jones Memorial Hospital as our one full-service acute care facility. If we assume 20% of patients depend on Medicaid, how will Jones sustain its business model when those patients can no longer pay? Will Jones have to cut services and turn uninsured patients away? 10% of the state's 2023 Medicaid budget went towards acute care. If these funds are eliminated, think about the strain not only on Jones, but also on other facilities used by residents of Allegheny County. Facilities in Dansville, Warsaw, Genesee, Olean. Medicaid cuts will stress all of these. We might even get to the point where hospitals will have to close, and acute medical care for people in this county is only available in Buffalo and Rochester. How will our residents manage? Already, this legislature has had to prop up medical transport services. Picture the impact of thousands more patients needing to travel farther for surgeries and tests. Picture the ambulance rides when there's no nearby hospital. When Medicaid funds are eliminated, it will also affect physicians' offices, laboratory services, physical therapy, radiology, pharmacists, and dentists. How will these services stay in business when their patients can no longer pay? Even people with private health insurance will have to go farther to find these services when they close. In the past decade, the county's population has decreased by 5%. The median age has risen from 42 to 44.5. Residents 65 and older now make up 27.9% of our population, more than a quarter of us. So dependence on Medicare and Medicaid just is going to increase year after year within the county. The dominoes that will fall as Medicaid is cut, people can't afford medical care. Institutions will have to reduce services or close altogether. Employers cannot keep or attract employees to a county with limited medical services. The tax base erodes as higher-paying companies leave the area. People without health care access and without jobs abandon Allegheny County. Honorable legislators, it is incumbent upon you to anticipate and work to mitigate the harms of the inevitable and likely devastating Medicaid cuts. Thank you for hearing me.
Thank you. Good afternoon.
Good afternoon. My name is Lily Milliman. I live in Fillmore in the town of Hume. I'm a retired art teacher. I taught in Fillmore Central School for 33 years. I think we can all agree that our public schools are at the heart of our local communities. I'm here to express my concern to you about the repercussions our schools may face with the loss of the Department of Education funding, and to ask you for your advocacy in trying to prevent this from happening. The county website lists 19 schools and BOCES. 13 of these schools within the county, and there are 7 schools outside the county that may serve Allegheny County students. Collectively, these schools receive $13.5 million in the Department of Education funding. Department of Education funding goes towards many useful and needed services and support. These include Title I is the one of the federal funding streams that supplements how much money each state allocates for schools. This funding aims to aid students who have burdens that may get in the way of accessing equitable education. These burdens include poverty and living in isolated rural districts. Every single school district in Allegheny County receives these funds. IDA grants are intended to support early intervention and special education services for infants, toddlers, children, youth with disabilities, and their families. The IDA stands for Individuals with Disabilities Education. There are 13 conditions covered under the IDA. They are autism, deaf, blindness, deafness, emotional disturbance, hearing impairment, intellectual disability, multiple disabilities, orthopedic impairment, and other health impairments such as chronic disease or rare disease, a specific learning disability, speech or language impairment, traumatic brain injury, and visual impairment. Every disabled student has an IEP, an individual education plan. It is a legal document that outlines the special education services, supports, and accommodations a student with a disability needs to thrive in school. IEPs are developed collaboratively by a team, including parents, school staff, and the students, if age 16 or older. To be eligible for an IEP, a student must be eligible for public school, be at least 3 years old, have one or more of the 13 conditions covered under IDEA, need services to thrive in school. The loss of IDEA funding will do immeasurable harm to children with disabilities. Other programs that the Department of Education funds in our school includes Title II-A, Title IX, and Teachers of Tomorrow. The Teachers of Tomorrow program combats the looming teacher shortage and offers specific incentives to help districts across the state to recruit and retain teachers. And finally, at a risk will be the universal pre-K program that our school districts provide and implement. The universal pre-K is almost $4 million. DOE cuts will also affect funding to the state. What is unclear is whether the state funding focus will have the effect on the funding the state provides school districts as well. President Trump has shared an intent to close the Department of Education, but that requires an act of Congress and the Senate to act. Congressman Thomas Macy has introduced Bill 899 to abolish the Department of Education. We are unclear what Congressman Langworthy's position is on this, but we hope this legislative body would take action to make a case to Congressman Langworthy that the funding should be hands-off. The quality of education in our schools depend on it. Thank you.
Thank you.
Last but not least.
Well, she went long, so you only have 30
and
seconds.
I'll make it brief. I don't think I can talk that fast, though. My name is Patty McEwen, and I'm from the town of Hume. And on January 28th, this body issued a press release acknowledging that although Allegheny County is a recipient of both direct and indirect federal funding, you didn't see or pose an immediate threat to the level of services. You acknowledge that some contracted agencies may choose to voluntarily limit services and that you would continue to monitor your contracts to ensure county services remain intact. Since then, nothing. I'm sure you are aware of the impact on our small county of any loss of funding for Medicaid, USDA, the Department of Education, even the $14.5 million you have listed in your budget would have on our citizens, on our healthcare institutions, nursing homes, mental health services, farmers, the disabled, our schools. And you in the past have advocated against cuts when they came from the state. When the governor's budget in fiscal '24 was proposed, you all issued a resolution against that. You made a public statement. One of you encouraged people to contact their legislators. We're talking about right now, this congressional district over a 9-year period, just in Medicaid, losing $2.32 billion. $2.32 billion. There's a bill in the House that calls on the Department of Education. Already you've probably seen news reports that FoodLink has been cut out from USDA funding, and that will directly impact the food pantries in our county. The county could be looking at the loss of health care, the loss of their boarding being covered for nursing aid patients, a stress on all of our institutions, cuts to farmers, USAID cuts to schools, etc. In the past, when Congressman Langworthy has asked something of you, I've seen a response. I hope that door is open both ways. We're asking 3 things today. Use your bully pulpit. Use it to try to prevent this harm. For the legislator to look at the county's budget to see where changes could be made, where you could fill potential gaps, and if services are cut, for you to act quickly, to act to protect our residents. That may be from the state, that may be from the county, that may be going back to the federal government. But I, for one, hope that you, our elected leaders, show you care about the residents of Allegheny County and that you do everything you can to ensure that the people are getting the care and services they need. Thank you.
Thank you. Any further comment today by any members of the public? If not, I want to thank you all for joining us today, taking the time to come see us. We appreciate the message, and we've heard it, and stay tuned. Thank you. Anything on our desks today?
On your desk today, you'll find a report of interfund transfers and tax bill corrections for the month of March. You also have an updated calendar for April. Committee of the Whole meetings were added for April 9th and the 23rd. We received correspondence dated March 27th from the Allegheny County Industrial Development Agency issuing a public hearing resolution, notice of public hearing, and corrected notice of public hearing for the proposed McCormick, New York CSG LLC project. The public hearing is scheduled for April 8th at 5:30 p.m. Pursuant to Article 11 of the New York State Real Property Tax Law, County Treasurer Terry Ross filed certificates of reinstatement of delinquent tax liens for properties in the towns of Angelica, Wellsville, and Wirt in the Clerk of the Board's office on April 1st. We received a 60-day notice of intent to file an application related to the Weathersfield repowering project. This was an application with the Office of Renewable Energy Siting and Electric Transmission to build a zero-emission wind energy facility. The notice of the next inter-county meeting will be hosted by Wyoming County at the Beaver Hollow Conference Center and Javis Center on April 18th. We received correspondence from NYSERDA, Project Manager Jen Cauldron forwarding a notice of intent to undertake an action within an agricultural district for the construction of Allegheny CSG Number 3 LLC in the town of Rushford. And we also received March 2025 reports from Medical Transport Service. Chairman Harris will be reappointing members to the Southern Tier West Regional Planning and Development Board. He's reappointing Keir Durham of Ulman, New York, Jerry Scott of Cuba, New York, and Craig Clark of Alfred, New York. This is for a 3-year term commencing June 1st and expiring May 31st of '25. This appointment is subject to confirmation by the Board of Legislators. Doesn't matter to me. All right. Chairman Harris is proclaiming April 2025 as the Fair Housing Month, whereas April 11th, 2025 marks the 57th anniversary of the passage of the Fair Housing Act, which affirms national policy of fair housing for all who live in the United States. And whereas the Fair Housing Act prohibits discrimination based on race, color, religion, sex, handicap, familial status, and national origin. And whereas this act provides equal housing opportunity for all Americans, regardless of race, color, religion, sex, or national origin, as well as to ensure fair practice in the sale, rental, or financing of property. And whereas the Fair Housing Amendments Act of 1988 added new rights, remedies, monetary penalties, and strengthened its enforcement procedures. And whereas the Fair Housing Amendments Act seeks to provide equal housing opportunities to affirmatively further housing choices, to eliminate legal barriers to equal housing, and to emphasize equal housing as a fundamental right to all. And whereas economic stability, community health, and human relations in communities are improved by diversity and integration. And whereas Allegheny County is committed to fair housing and promotes services and activities provided by private and public entities for equal housing opportunities for all residents and prospective residents. And whereas Allegheny County fully supports the intent and purpose of the Federal Fair Housing Act, local fair housing laws, and follows policies and practices in order to achieve its goal. Now therefore, Chairman W. Brooke Harris, Chairman of the County Board of Legislators, hereby proclaims April 2025 as Fair Housing Month in Allegheny County. He also read a proclamation earlier for Child Abuse Prevention Month.
Resolutions?
Intro number 15025. Creation of one full-time position of accountant and abolishing one full-time position of fiscal manager within the Department of Public Works. This resolution is being offered by the Public Works and Personnel Committees.
Motion made by legislator Fanton, seconded by legislator Demick. Discussion? Roll call.
Mr. Healy?
Yes.
Mr. Ricky?
Yes.
Mrs. Ricketts Swales?
Yes.
Mrs. Root?
Yes.
Mr. Stockin?
Yes.
Mr. Barnes?
Aye.
Mr. Bissett?
Yes.
Mr. Burdick, or Mrs. Burdick?
Yes.
Mr. Curran?
Yes.
Mr. Demick?
Yes.
Mr. Fanton?
Yes.
Mrs. Hanchett?
Yes.
Mr. Harris?
Yes.
And Mr. Havey.
Yes.
14 ayes, 1 absent.
That resolution is approved.
Intro number 15125, a resolution designating the County of Allegheny as the lead agency for the New York State Environmental Quality Review of the 8-year review of Agricultural District Number 4 and its proposed modification and continuation. This resolution is being offered by the Resource Management Committee and has committee approval.
Mr. Curran makes the motion, seconded by legislator Hanchett. Discussion? This resolution can be voice voted. All those in favor say aye.
Aye.
Opposed? And that is approved. Would anyone care to make a motion to consider resolutions with intro numbers 152 of 25 through 154 of 25 together? Thank you, Mr. Ricky, seconded by legislator Hanchett. All those in favor say aye.
Aye.
Opposed? And that's carried.
Intro number 15225, approval of grant application for the 2025-2026 New York State Archives Local Government Records Management Improvement Funds Grant. Intro number 15325, approval of letter of commitment between the County of Allegheny and Casa Trinity in support of Casa Trinity's application for Health Resources and Services Administration funding for the Rural Communities Opioid Response Program Impact Grant for the Department of Health, authorizing the Public Health Director to execute said letter of commitment. Intro number 15425, approval of grant application to the Allegheny County Area Foundation for the Department of Health, ratifying the signature of the Public Health Director on said grant application.
Would anyone care to make a motion to pass these resolutions? Thank you, Legislator Burdick, seconded by Legislator Fanton. Discussion? Roll call.
Mr. Healy.
Yes.
Mr. Ricky.
Yes.
Mrs. Ricketts Swales.
Yes.
Mrs. Root.
Yes.
Mr. Stockin. Mr. Barnes.
Aye.
Mr. Bissett.
Yes.
Mrs. Burdick. Mr. Curran.
Yes.
Mr. Demick.
Yes.
Mr. Fanton.
Yes.
Mrs. Hanchett.
Yes.
Mr. Harris.
Yes.
Mr. Havy.
Yes.
14 ayes, 0 noes. Oh, sorry, 1 absent. I'm
Those
sorry.
resolutions are approved.
Intro number 15525, approval of increase in 2024-2025 payment rate within the preschool evaluation program and maintenance of 10% take-back due to serving as the approved 4410 preschool evaluation team for the Department of Health. This resolution is being offered by the Human Services Committee and has committee approval.
Legislator Burdick makes the motion, seconded by Legislator Ricketts Swales. Discussion? Roll call.
Mr. Healy? Mr. Ricky?
Yes.
Mrs. Ricketts Swales? Mrs. Root?
Yes.
Mr. Stockin? Mr. Barnes?
Aye.
Mr. Bissett?
Yes.
Mrs. Burdick?
Yes.
Mr. Curran?
Yes.
Mr. Demick?
Yes.
Mr. Fanton?
Yes.
Mrs. Hanchett?
Yes.
Mr. Harris?
Yes.
Mr. Havy?
Yes.
14 ayes, 1 absent.
That resolution's approved. Would anyone care to make a motion to consider resolutions with intro numbers 156 of 25 through 158 of 25 together? Thank you, Mr. Bissett, seconded by Legislator Ricky. All those in favor say aye.
Aye.
Opposed? And that's carried.
Intro number 15625, acceptance of insurance payment from New York Municipal Insurance Reciprocal for repair of a 2020 Kenworth T800 haul truck, VIN 1NKDL40X0LR 396538. Intro number 15725, acceptance of insurance payment from New York Municipal Insurance Reciprocal for repair of 2020 Kenworth 10-wheel dump truck, VIN 3BKDL40XXLF 414816. Intro number 15825, acceptance of insurance payment from New York Municipal Insurance Reciprocal for lightning strike claim at the Whitesville Tower on September 21st, 2024. These are being offered by the Public Works Committee and Ways and Means and have committee, sorry, they are offered by Ways and Means and have committee approval.
Thank you, ma'am. Is there a motion to pass these blocked resolutions? Motion by Legislator Stockin, seconded by Legislator Fanton. Discussion? Roll call.
Mr. Healy?
Yes.
Mr. Ricky?
Yes.
Mrs. Ricketts Swales?
Yes.
Mrs. Root?
Yes.
Mr. Stockin? Mr. Barnes?
Aye.
Mr. Bissett?
Yes.
Mrs. Burdick?
Yes.
Mr. Curran?
Yes.
Mr. Demick?
Yes.
Mr. Fanton?
Yes.
Mrs. Hanchett?
Yes.
Mr. Harris?
Yes.
Mr. Havy?
Yes.
14 ayes, 1 absent.
Those are approved.
Intro number 15925, approval of budget transfer from contingency to the Board of Elections to cover 2 new positions approved by resolution number 10625. This resolution is being offered by the Ways and Means Committee and has committee approval.
Motion by Legislator Stockin, seconded by Legislator Fanton. Discussion? Roll call.
Mr. Healy?
Yes.
Mr. Ricky?
Yes.
Mrs. Ricketts Swales?
Yes.
Mrs. Root?
Yes.
Mr. Stockin?
Yes.
Mr. Barnes?
Aye.
Mr. Bissett?
Yes.
Mrs. Burdick? Mr. Curran?
Yes.
Mr. Demick?
Yes.
Mr. Fanton?
Yes.
Mrs. Hanchett?
Yes.
Mr. Harris?
Yes.
Mr. Havy?
Yes.
14 ayes, 1 absent.
That's approved. Would Would anyone care to make a motion to consider resolutions with intro numbers 160 of 25 and 161 of 25 together? Thank you, Mr. Bissett, seconded by legislator Curran. All those in favor say aye.
Aye.
Opposed, and that's carried.
Intro number 16025, reappropriation of unspent federal non-personnel service lead hazard reduction capacity grant program funds for the Department of Health. Intro number 16125, reappropriation of unspent federal non-personnel service public health infrastructure grant funds for the Department of Health. These resolutions are being offered by the Human Services and Ways and Means Committees and have committee approval.
Motion made by legislator Burdick, seconded by legislator Ricketts Swales. Discussion? Roll call.
Mr. Healy?
Yes.
Mr. Ricky?
Yes.
Mrs. Ricketts Swales? Yes. Mrs. Root?
Yes.
Mr. Stockin? Yes. Mr. Barnes?
Aye.
Mr. Bissett?
Yes.
Mrs. Burdick?
Yes.
Mr. Curran?
Yes.
Mr. Demick?
Yes.
Mr. Fanton?
Yes.
Mrs. Hanchett?
Yes.
Mr. Harris?
Yes.
Mr. Havy?
Yes.
14 ayes, 1
And
absent.
those are approved.
Intro number 16225, acceptance and appropriation of National Children's Alliance grant for the Child Advocacy Center for the Department of Social Services. This resolution is being offered by the Human Services and Ways and Means Committees and has committee approval.
Motion made by legislator Burdick, seconded by legislator Ricketts Swales. Discussion? Roll call.
Mr. Healy?
Yes.
Mr. Ricky?
Yes.
Mrs. Ricketts Swales? Mrs. Root?
Yes.
Mr. Stockin? Mr. Barnes?
Aye.
Mr. Bissett?
Yes.
Mrs. Burdick?
Yes.
Mr. Curran?
Yes.
Mr. Demick?
Yes.
Mr. Fanton?
Yes.
Mrs. Hanchett?
Yes.
Mr. Harris?
Yes.
Mr. Havy?
Yes.
14 ayes, 1 absent.
That resolution's approved.
Intro number 16325. Acceptance and appropriation of New York State Office of Children and Family Services National Grant Funds for the Department of Social Services. This resolution is being offered by the Human Services and Ways and Means Committees and has committee approval.
Motion by legislator Burdick, seconded by legislator Ricketts Swales. Discussion? Roll call.
Mr. Healy?
Yes.
Mr. Ricky?
Yes.
Mrs. Ricketts Swales? Mrs. Root?
Yes.
Mr. Stockin? Mr. Barnes?
Aye.
Mr. Bissett?
Yes.
Mrs. Burdick?
Yes.
Mr. Curran?
Yes.
Mr. Demick?
Yes.
Mr. Fanton? Mrs. Hanchett?
Yes.
Mr. Harris?
Yes.
Mr. Havy?
Yes.
14 ayes, 1 absent.
That's approved.
Intro number 16425. Reappropriation of unspent state poll books early voting grant funds for the Board of Elections. This resolution is being offered by the Ways and Means Committee and has committee approval.
Motion by legislator Stockin, seconded by legislator Fanton. Discussion? Roll call.
Mr. Healy?
Yes.
Mr. Ricky?
Yes.
Mrs. Ricketts Swales? Mrs. Root?
Yes.
Mr. Stockin? Mr. Barnes?
Aye.
Mr. Bissett?
Yes.
Mrs. Burdick?
Yes.
Mr. Curran?
Yes.
Mr. Demick?
Yes.
Mr. Fanton? Mrs. Hanchett?
Yes.
Mr. Harris?
Yes.
Mr. Havy?
Yes.
14 ayes, 1 absent.
That's approved.
Intro number 16525. Reappropriation of unspent Federal Appalachian Regional Commission, New York 217-613-0224, Trails Master Grant Funds for the Office of Planning. This resolution is being offered by the Planning and Economic Development and Ways and Means Committees and has committee approval.
Motion by legislator Root, seconded by legislator Hanchett. Discussion? Roll call.
Mr. Healy?
Yes.
Mr. Ricky?
Yes.
Mrs. Ricketts Swales? Yes. Mrs. Root?
Yes.
Mr. Stockin? Yes. Mr. Barnes?
Aye.
Mr. Bissett?
Yes.
Mrs. Burdick?
Yes.
Mr. Curran?
Yes.
Mr. Demick?
Yes.
Mr. Fanton? Mrs. Hanchett?
Yes.
Mr. Harris?
Yes.
Mr. Havy?
Yes.
14 ayes, 1 absent.
That resolution is approved.
Intro number 16625. Reappropriation of unspent 2024 Consolidated Highway Improvement Program grant funds for the Department of Public Works. This resolution is being offered by the Ways and Means Committee and has committee approval.
Mr. Stockin makes the motion, seconded by legislator Fanton. Discussion? Roll call.
Mr. Healy?
Yes.
Mr. Ricky?
Yes.
Mrs. Ricketts Swales? Yes. Mrs. Root?
Yes.
Mr. Stockton? Mr. Barnes?
Aye.
Mr. Bissett?
Yes.
Mrs. Burdick?
Yes.
Mr. Curran?
Yes.
Mr. Demick?
Yes.
Mr. Fanton?
Yes.
Mrs. Hanchett?
Yes.
Mr. Harris?
Yes.
Mr. Havy?
Yes.
14 ayes, 1 absent.
That resolution's approved. Would anyone care to make a motion to consider resolutions with intro numbers 167 of 25 through 169 of 25 together? Thank you, Legislator Hanchett. Seconded by Legislator Havy. All those in favor say aye. Opposed? That's carried.
Intro number 16725, amending resolution number 29324, approval of preschool service provider and evaluation service agreements, preschool special education itinerant services, and center-based agreements between the County of Allegheny and school districts entities for the preschool program for the Department of Health, authorizing the chairman of the board to execute said agreements. Intro number 16825, approval of preschool service provider and evaluation service agreement between the County of Allegheny and Amy Brush for the preschool program for the Department of Health, authorizing the chairman of the board to execute said agreement. Intro number 16925, approval of data use agreement between the County of Allegheny and the New York State Department of Health for biospatial for the Department of Health, authorizing the chairman of the board to execute said agreement. These resolutions are being offered by the Human Services Committee and have committee approval.
Legislator Burdick makes the motion, seconded by Legislator Ricketts Swales. Discussion? Roll call.
Mr. Healy?
Yes.
Mr. Ricky?
Yes.
Mrs. Ricketts Swales?
Yes.
Mrs. Root?
Yes.
Mr. Stockton?
Yes.
Mr. Barnes?
Aye.
Mr. Bissett?
Yes.
Mrs. Burdick?
Yes.
Mr. Curran?
Yes.
Mr. Demick?
Yes.
Mr. Fanton?
Yes.
Mrs. Hanchett?
Yes.
Mr. Harris?
Yes.
Mr. Havy?
Yes.
14 ayes, 1 absent.
Those resolutions are approved. Would anyone care to make a motion to consider resolutions with intro numbers 170 of 25 through 176 of 25 together? Thank you, Mr. Bissett, seconded by Legislator Ricketts Swales. All those in favor say aye. Aye. Opposed? And that's carried.
Intro number 17025, approval of amended agreement between the County of Allegheny and Total Senior Care Incorporated for social day services for the Office for the Aging, authorizing the chairman of the board to execute said agreement. Intro number 17125, approval of agreement between the County of Allegheny and Will Care Incorporated for home care services for the ISEP 3E Unmet Needs and Alzheimer Respite Grants for the Office for the Aging, authorizing the chairman of the board to execute said agreement. Intro number 17225, approval of amended agreement between the County of Allegheny and the Center for Elder Law and Justice for legal services for Allegheny County residents age 60 and over for the Office for the Aging, authorizing the chairman of the board to execute said agreement. Intro number 17325, approval of agreement between the County of Allegheny and Legal Assistance of Western New York for legal services for Allegheny County residents age 60 and over for the Office for the Aging, authorizing the chairman of the board to execute said agreement. Intro number 17425, approval of agreement between the County of Allegheny and Annette Harding Esquire for legal services for Allegheny County residents age 60 and over for the Office for the Aging, authorizing the chairman of the board to execute said agreement. Intro number 17525, approval of agreement between the County of Allegheny and Highland Park Adult Day Care for medical model day services for the elderly for the Office for the Aging, authorizing the chairman of the board to execute said agreement. Intro number 17625, approval of first one-year extension of agreement between the County of Allegheny and Life Station Incorporated for personal emergency response system services for the Office for the Aging, authorizing the chairman of the board to execute said agreement. These resolutions are being offered by the Human Services Committee and have committee approval.
Motion by Legislator Burdick, seconded by Legislator Ricketts Swales. Discussion? Just a heads up, I'm going to be a no on one of them
Okay.
when we get there. Roll call.
Mr. Healy?
Yes.
Mr. Ricky?
Yes.
Mrs. Ricketts Swales?
Yes.
Mrs. Root?
Yes.
Mr. Stockton?
Yes.
Mr. Barnes?
Aye.
Mr. Bissett?
Yes.
Mrs. Burdick? Mr. Curran?
Yes.
Mr. Demick?
Yes.
Mr. Fanton?
Yes.
Mrs. Hanchett?
Yes.
Mr. Harris?
Yes on all, but no on 173 of 25.
Mr. Havy?
Yes.
Okay, so on intro numbers 170, 171, 2, 4, 5, 6, we have 14 ayes, 1 absent. On 173-25, we have 13 ayes, 1 no, and 1 absent.
Those resolutions are approved.
Intro number 17725. Approval of agreement between the County of Allegheny and Hillside Children's Center for One Family Services for the Department of Social Services, authorizing the chairman of the board to execute said agreement. This resolution is being offered by the Human Services Committee and has committee approval.
Motion by legislator Burdick, seconded by legislator Ricketts Swales. Discussion? Roll call.
Mr. Healy?
Yes.
Mr. Ricky?
Yes.
Mrs. Ricketts Swales? Yes. Mrs. Root? Yes. Mr. Stockin? Yes. Mr. Barnes?
Aye.
Mr. Bissett?
Yes.
Mrs. Burdick?
Yes.
Mr. Curran?
Yes.
Mr. Demick?
Yes.
Mr. Fanton?
Yes.
Mrs. Hanchett?
Yes.
Mr. Harris?
Yes.
Mr. Havy?
Yes.
14 ayes, 1 absent.
That resolution is approved. How do you prefer the reading of the audit today?
Collectively and by totals.
So moved by legislator Stockin, seconded by legislator Fanton. All those in favor say aye. Aye. Opposed, and that's carried.
General government support, $134,628.56. Education, $169,073.44. Public safety, $70,544.50. Health, $184,672.02. Bus transportation, $11,859.58. Economic assistance and opportunity, $869,323.16. Culture and recreation, $3,175.61. Home and community services, $196,982.47. The general fund totals, $1,640,259.34. Payroll and taxes, $1,350,458.13. Capital fund is $851,145.08. Other funds total $772,642.63 for a grand total of $4,614,505.18.
Is there a motion to approve the audit? Thank you, legislator Root, seconded by legislator Fanton. Discussion? Legislator Hanchett.
Yes, under education, line item 2960, special ed. Can you tell me a little bit more what that is? It's,
That is
the
for,
amount-
yes, Legislator Hanchett, that is for all the special ed education that is provided through the Department of Health. It includes transportation contracts and the actually services that are provided.
That's quite a bit, and I'm glad we're able to provide this at this time.
Yeah, it's Tyler can correct me if I'm wrong, but it's like 59.5% reimbursed by the state, and basically 40.5 is local share.
Thank you.
You're welcome.
Further discussion? Roll call.
Mr. Healy?
Yes.
Mr. Ricky?
Yes.
Mrs. Ricketts Swales? Yes. Mrs. Root?
Yes.
Mr. Stockin? Mr. Barnes?
Aye.
Mr. Bissett?
Yes.
Mrs. Burdick?
Yes.
Mr. Curran?
Yes.
Mr. Demick?
Yes.
Mr. Fanton?
Yes.
Mrs. Hanchett?
Yes.
Mr. Harris?
Yes.
Mr. Havy?
Yes.
14 ayes, 1 absent.
The audit is approved. Anything for the good of the order today? Legislator Burdick.
Thank you, Chairman. I just would like to respond to the ladies that were here during the public comment period. I just would like to reassure them at this time that we heard them, that our administration, our department heads, and all of us are keeping a very close eye of what's going on in Washington, and we also are concerned, but at this point, we have not lost any funding, and I want to reassure them again that we heard them. Thank you.
Thank you. Anything else for the good of the order? Mr. Healy.
Yeah, it's also on the same point. Obviously, the ladies all came together, must appear to be part of a group or organization. Or,
I'm not sure.
but they did come together and certainly had a political, appear to have a political motive to their comments. I question their facts and also their data, and I don't know. None of that was provided to us in person. So I just wish we should make it a public forum for people to air their political agendas in the boardroom. And we're all concerned about any possible cuts anytime, any place. But most of my understanding is most of that funding they're talking about is going to go directly to the state. So if anything, there may be more money. What the state of New York does with it, you never know. Thank you.
Thank you. I might add a clarification. We do welcome all public comment, even if it differs from our own. But in many cases, it does differ from our own. Further discussion and go to the order? I'll remind the board, we do have a committee of the whole following this meeting. It's scheduled for 2:45. Take a 5-minute break between meetings and start that meeting at 3:10. The entirety of the meeting is going to be held in executive session for the purpose of discussing the medical, financial, credit, or employment history of a particular person. Thus, we will not be starting the live stream at all. There will be no board action taken at the conclusion of the executive session, so that's just for the viewing public to be aware. There will be no live stream. Would anyone care to make a motion to adjourn? Thank you, Legislator Hanchett. Second by Legislator Barnes. All those in favor say aye.